Hey guys, today we're talking about skin problems in kids. Hi everyone, it's me, Dr. Nooreen, your resident foot and ankle specialist, and welcome back to my channel. Okay guys, so today we're going to be talking about common skin problems that you can see in children or kids, and the first one we're going to talk about is athlete's feet. And yes, kids can get athlete's feet too. So if you have someone in your house that has athlete's feet is contagious. So whether you're a kid or an adult, if someone does have it, you can definitely transfer it to someone else, even if that person's a kid. Now, you guys, kids naturally have more hydrated skin, so that actually puts them at a greater risk of developing athlete or teniapitis, because athlete's feet or teniapitis is caused by a fungal infection. And like I stated in a few of my videos before, you guys, fungus loves warm, dark, moist environments to grow in. And since kids' skin is naturally more hydrated, it's naturally a little bit more moist than an adult's skin. So you guys, because fungus likes that dark, moist, warm environment, a few perfect places for it to grow at are pools, public showers, and gyms. If your skin is exposed to any of these areas, it can be exposed to that fungus and then in turn get a fungal infection, which we call athlete's feet. So you guys, what are the symptoms of athlete's feet? Symptoms are you're usually going to get cracked, dry, itchy, scaly, red, bumpy skin on your feet, and it's usually more prevalent in between your toes. But that doesn't mean it can't be present elsewhere. It definitely can be. And athlete's feet can also be accompanied with an unpleasant foot odor. And you guys, like I mentioned before, athlete's feet is contagious. It can spread. So if you are in any of those public type areas, make sure you're wearing something to protect your skin. That can be water shoes or just anything between your skin and the surface of the public area that you're walking. You guys, how do you treat athlete's feet? Now, there's a few things you can do at home to try to get rid of this. Now, in general, you want to make sure you're keeping your feet dry and cool because you want to not provide that fungus with the environment that it likes to grow in, which is dark, warm, and moist. So you're going to make your feet dry and cool. You can accomplish this by changing your socks in the middle of the day, doing Epsom salt water soaps to dry out your feet. You can also use an antiperspirant spray that contains aluminum on your feet if your feet do also get really sweaty. You can spray Lotrimin spray in your shoes once a day, and you can also apply a topical antifungal cream on your skin itself. Now guys, if you're doing all those things at home and it's not working, you have to bring your child in to see your foot specialist, and we can prescribe antifungal medications that are a higher concentration and also provide you with some alternative treatment options. Okay guys, the next most common problem kids can have are ingrown toenails. And I do have a whole video about ingrown toenails. Guys want to hear about it in more depth. I'm going to keep it a little bit more general in this video. So you guys, what is an ingrown toenail? An ingrown toenail is when the sides of your nails start to grow into your skin, causing irritation and inflammation, and could potentially lead to an infection. So you guys, how do you prevent and treat ingrown toenails? In order to prevent and treat your child's ingrown toenails, make sure you're cutting their nails straight across. Don't curve the corners of their nails into their skin. Just let it be a square top and let that nail just go straight up and down. Now, if your child's nail border is getting red, hot, irritated, inflamed, and you potentially even have pus coming out of there, that indicates an infection and you need to take your child to your local foot and ankle specialist. You guys, ingrowns can be very painful, but they are something that are very treatable. So if your child has that problem, definitely take them to your local foot and ankle specialist. Okay, you guys, kids can get warts too. That's the next thing we're talking about, warts. This is a very common skin infection, especially in kids, that looks like a callus or a fleshy growth on the skin, and it's usually on the bottom of their feet. Hey guys, I do have an entire video about warts if you want to hear about them more in detail. Again, in this video, I'm going to keep it a little bit more general. So warts are caused by the HPV virus, which then embeds itself into the skin. It actually goes into the deeper layers of skin. Warts in general usually need to be treated by a physician because you need to debride that area to get the medication that you're using to try to actually have an effect on the virus. So if you buy something over the counter and you're putting it on top of that area and you don't really see a difference, that could be a reason why, is because you're not actually being able to apply that medication to where the wart is. So seeing your foot and ankle specialist can definitely help treat your warts because they can get the medication to where that wart is actually living in the layers of your skin. And you guys, like athlete's foot, which is caused by a fungal infection, warts, which is caused by a virus, that virus is everywhere. So again, if you're taking your child to any sort of a public area, please make sure that their feet are covered and that their bare feet are not touching the ground, because that would definitely increase their chances of getting a wart or athlete's feet. Okay guys, so that was a really quick look at some common skin problems that kids can have. If your kids have a skin problem, definitely take them to your local foot and ankle specialist. If you guys have any comments or questions or concerns about any of these topics, please leave them in the comment section down below and I will do my best to answer them. And as always, you guys, don't forget to stretch and subscribe, like this video, and I'll see you guys next week. Bye!